and check. Table exam. Gonna wash my hand. Hi Bella, my name is Lillian. I'm the nurse practitioner student.
Hi, nice to meet you.
Nice to meet you too. So today I'm gonna conduct the musculoskeletal exam. Before we begin, I want to ask for your permission so I can, together with you, we're gonna do some tests, and I'm gonna touch or palpate your joint, your muscular. Is that okay?
Yes.
And for the education and training purposes, I'm gonna record this video.
Okay.
All right. So first, I'm gonna start with inspecting your hands. So open inspection, bilateral, fingers and hands. I don't appreciate any swelling, redness, atrophy, deformity, or joint asymmetry. Next, I'm gonna palpate for the distal interphalangeal of each finger. I don't appreciate any swelling, tenderness, or nodule. I'm gonna palpate the proximal interphalangeal of each finger. I don't appreciate any swelling, tenderness, or nodule. And then I'm gonna palpate for the metacarpophalangeal of each finger. I don't appreciate any swelling, tenderness, or nodule. Next, I'm gonna have you to do some range of motion test with me. I'm gonna have you to make a fist. I appreciate full range of motion. Now I'm gonna you're gonna flex your fingers, extend your finger, and then adduct the fingers, and then adduct the fingers. I appreciate full range of motion for fingers, flexion, extension, adduction, and adduction. Next, I'm gonna check your wrist. I'm gonna inspect your wrist bilaterally, so I don't appreciate any swelling, redness, deformity, atrophy, nodule, or joint atrophy, or joint asymmetry bilaterally. Next, I'm gonna palpate for the carpal bone and the metacarpal. I'm gonna palpate bilaterally, carpal, metacarpal. I don't appreciate any tenderness, swelling, or nodule bilaterally. And then I'm gonna have you to do some tests with me. You're gonna flex your wrist, extend your wrist, then ulnar deviation, radial deviation. I appreciate full range of motion, bilateral wrist, flexion, extension, ulnar deviation, and radial deviation. Now I'm going to do the test, tonal test. On your right side first, you're going to extend your wrist. I'm going to tap right here with my middle finger. I'm going to tap the medial nerve. You feel any tingling or any pain travel from your palm over your fingers, especially your little finger and the ring fingers. Any pain? Any tingling, numbing? So the test is negative on the right wrist. We're going to do the tonal test. My middle finger tapping on the middle nerve. Any pain or numbing, tingling? No. Negative for tonal test bilaterally. Now I'm going to do the parallel test. You're going to flex your wrist and put this together. Yep, do it for 60 seconds. If you have any pain, any tingling, let me know, okay? I'm going to do this test for about 40 seconds to 60 seconds. Do you feel any pain?
No.
So the parallel test negative bilaterally. Next, I'm going to inspect for the elbow bilaterally. I don't appreciate any swelling, deformity, redness, joint asymmetry at nodule, bilaterally elbows. Next, I'm gonna palpate for the extension of ulnar. Extension of the ulnar. I don't appreciate any tenderness, swelling, and nodule. And I'm gonna palpate for the lateral. I'm gonna palpate for the olecranon process. I don't appreciate any tenderness, swelling, nodule, bilaterally. Next, I'm gonna palpate for the lateral epicondyle or the tennis elbow. I'm gonna palpate bilaterally for the lateral epicondyle or tennis elbow. I don't appreciate any tenderness, swelling, or nodule. And then I'm gonna palpate for the medial epicondyle or golfer elbow bilaterally. Medial epicondyle or golfer elbow. I don't appreciate any tenderness, swelling, or nodule. You have any pain while palpating?
No.
So now we're gonna do some range of motion. We're gonna flex, extend, supination, pronation. I appreciate full range of motion for the elbows, flexion, extension, pronation, and supination. Next, I'm gonna move to the shoulder. I'm gonna inspect the shoulder anteriorly and posteriorly. I don't appreciate any tenderness, any swelling, deformity, joint asymmetry, nodule, redness, bilateral shoulder. Next, I'm gonna palpate for the shoulder. I'm gonna palpate for the acromioclavicular joint. Connect the acromial and clavicular bilaterally. I don't appreciate any tenderness, swelling, or nodule bilaterally. And then I'm gonna palpate for the bicep groove. Connect the bicep muscle to the humerus. I don't appreciate any tenderness, swelling, or nodule bilaterally. Next, I'm gonna palpate for the tubercle of the humerus. I don't appreciate any swelling, tenderness, or nodule bilaterally. And then I'm gonna palpate for the coracoid process. The clavicle is superior to the clavicle bilaterally. I don't appreciate any swelling, tenderness, or nodule. And then I'm gonna palpate for the subdeltoid bursa, subdeltoid muscle, subdeltoid bursa. I don't appreciate any tenderness, swelling, or nodule bilaterally. Then I'm gonna have you do some range of motion. We're gonna flex the shoulder, extend the shoulder, and then abduct the shoulder, internal rotation, external rotation. I appreciate full ranges of motion bilaterally of the shoulder for flexion, extension, abduction, adduction, internal rotation, and external rotation. Next, I'm going to inspect for the neck and cervical, anteriorly and posteriorly. I don't appreciate any swelling, tenderness, I don't appreciate any swelling, redness, atrophy, deformity, nodule, or joint asymmetry bilaterally. Next, I'm gonna palpate for the temporal mandibular joint. It's the superior to the tragus. Can you open your mouth for me and close? I don't appreciate any click or tenderness, opening and closing of the TMJ joint. Next, I'm gonna palpate for the sternoclavicle. I don't appreciate any tenderness, swelling, or nodule. And then I'm gonna palpate for the cervical spine. Can you tuck the chin to your chest? I don't appreciate any tenderness, swelling, or nodule over the cervical spine. Now I'm gonna palpate for the paramuscle, the trapezius. I don't appreciate any tenderness, swelling, or nodule. And then the rhomboid muscles. I have the including the minor rhomboid and major rhomboid. And major rhomboid. I don't appreciate any tenderness, swelling, or nodule. You have any pain when I palpate?
No.
Okay. I'm gonna have you to do some range of motion of the neck. We're gonna flex, extend, turn to the left, turn to the right. Now tilt your head to the left and tilt your head to the right. I appreciate full range of motion for the neck flexion, extension, lateral rotation bilaterally, and lateral flexion bilaterally, full range of motion. Now I'm gonna check for the range of motion for the jaw. Can you do like this, lateral? I appreciate full range of motion for the jaw. And then I'm gonna do the scrolling test. For this test, I'm gonna have you look up to the ceiling and then lateral. Look up to the ceiling and then lateral to bend your neck. I'm gonna keep this. I'm gonna push minor pressure. You have any pain?
No.
No pain, no tenderness, the negative swelling test. And next I'm gonna, can you please remove your socks? Just gonna check we're still in the camera. Okay. I'm gonna inspect for the toes and feet. Upon inspection, I don't appreciate any swelling, redness, atrophy, deformity, bunions, plantar walls, cones or calluses, bilateral feet. I'm gonna palpate for the distal. I'm gonna palpate for the interdigit neuroma. Any pain or tenderness?
No.
Any pain or tenderness?
No.
So I don't appreciate any neuroma bilaterally. Then I'm gonna palpate for the heel and the sole of the feet for any tenderness or pain to rule out the plantar fasciitis. Any pain or tenderness?
No.
I don't appreciate any tenderness or swelling. Next, I'm gonna have you to stand up to inspect for the flat feet. I don't appreciate any flat feet. You can sit down, please. Then I'm gonna palpate for the distal interphalangeal. I don't appreciate any tenderness, swelling, or nodule bilaterally. I'm gonna palpate for the proximal interphalangeal. I don't appreciate any tenderness, swelling, or nodule bilaterally. Now I'm gonna palpate for the metatarsal. Metatarsal phalangeal. I don't appreciate any tenderness, swelling, or nodule bilaterally. And then I'm gonna have you to curve your toes and then extend the toes. And then I'm gonna have you to point your sole inward. You can follow me inward and then evert. I appreciate full range of motion for the toes flexion and extension and inward and invert and evert of the foot. And next I'm gonna inspect the ankles. Upon inspection, I don't appreciate any swelling, redness, discoloration, deformity, or joint asymmetry of bilateral ankles. And then I'm gonna palpate for the this is the medial malleolus and lateral malleolus and Achilles tendon. I don't appreciate any tenderness, swelling, or nodule. Lateral malleolus, medial malleolus. No tenderness, swelling, or nodule bilaterally. Then I'm gonna have you. I'm gonna do the passive plantar flexion, dorsiflexion, plantar flexion, and ankle circle. Full range, passive range of motion. Plantar flexion, dorsiflexion. Full range of passive motion. Now I'm gonna have you to flex your feet, flex your ankle, and plantar flexion, and then do the circle. I appreciate full range of motion bilaterally. And next, I'm gonna have you to sit here on the exam table. Okay. I'm gonna prepare for the knee bilaterally. I'm gonna prepare for the suprapatellar push. Suprapatellar push. And then bilateral side of the patella. I don't appreciate any tenderness, swelling, or nodule. And upon inspection of the knee, I don't appreciate any deformity, swelling, redness, joint atrophy, or nodule bilateral knees. Next, I'm gonna do the passive extension, passive flexion, passive extension, passive flexion. I appreciate for passive range of motion. Now I'm gonna have you to extend your knee and then bend your knee. I appreciate full range of motion bilaterally. Now I'm gonna do some tests. I'm gonna have you to lay back on the exam table. So first, I'm gonna do the valgus. So I'm gonna have this 25 degree. I'm gonna grab a lateral aspect and the tibia. I'm gonna passively lateral. So I'm gonna passively abduct. And it is valgus. So I'm gonna do this right here. Any pain?
No.
I'm gonna do the valgus test. So I'm gonna grab this. Sorry. Yeah, we're in the camera. It may drop. So valgus test. So I'm gonna grab this. I'm gonna push the lateral pain. No pain.
No.
And then the valgus. I'm gonna have this. And push. Any pain?
No pain.
Valgus. Flex. Any pain?
No pain.
And then I'm gonna do the Leishman test. I'm gonna grab the lower femur, and then the tibia, and then pull and push. I don't appreciate any movement at the end. Any pain?
No.
It's a negative language. And then push and push anteriorly, posteriorly. I don't appreciate any movement. And do you have any pain?
No.
No pain. Then I'm gonna do the drawer test. I'm gonna flex the knee 90 degrees. Then I'm gonna stabilize the knee, then push and push. Any pain?
No.
I don't appreciate any minimal movement of the tibia, and the patient has no pain. Sorry. Any pain?
No.
It's a negative drawer test bilaterally, and then I'm gonna do the Murray test. I'm gonna flex the knee about 20 degrees, and we're gonna expand and move. Any pain?
No.
Negative McMurray test, and no click, no stiffness. Any pain?
No.
Negative McMurphy test bilaterally. Okay, so next I'm gonna move to, if you can sit up on the examiner table. I'm gonna inspect the hip. Can you please stand up for me? I'm gonna inspect for the anterior hip and then posterior hip. I don't appreciate any swelling, deformity, nodule, joint atrophy, bilateral hips. Now I'm gonna palpate for the anterior superior iliac joint in the greater trochanter and the greater trochanter. Now I'm gonna palpate for the posterior superior iliac joint, and then the sacral iliac joint. I don't appreciate any tenderness, swelling, or nodule or overpalpation in the hips. Now I'm gonna have you to sit down. You're gonna flex the knee about 20 degrees, and then expand, and then internal extension, external extension. I appreciate full range of motion for hips, internal extension and external extension. Now I'm going to have you to lay back on the examiner table. I'm going to do some passive range of motion. I'm going to have hips flexion, flexion, and then abduction, 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 abduction. Full passive range of motion for hip flexion, abduction, abduction. Can you please face down? And I'm going to do passive hip extension. Full range of passive hip extension. Now can you raise your right hip? Right leg. Now raise your left leg. Okay, can you please lay on your back? Can you move your right leg up? Yeah, and your left leg. And now move your leg toward the midline. And bring your leg away the midline, yes. And now do this with the left leg. Bring your leg toward the midline, and then bring your leg away the midline. I appreciate full range of motion for active hips, flexion, extension, abduction, and adduction. Now I'm gonna do the FOMAS test. I'm gonna have you to flex your knee toward your abdomen, and I see the thigh still laying flat on the table. So FOMAS test. negative on the right, and then gonna flex your knee towards you, and I see the thigh still lay flat. So my test negative bilaterally. Now I'm gonna do the fiber test. I'm gonna have you to do figure 4. I'm gonna press down your hip right here. Any pain?
No.
Negative fiber test. Figure 4. Any pain?
No.
Negative fiber test. Okay, so next I'm gonna have you to stand up, and I'm gonna inspect your spine. Upon inspection anteriorly and posteriorly, I don't appreciate any deformity, any abnormal posture, no lordosis, scoliosis, or kyphosis. And then I'm gonna inspect the height of the shoulder and the hips anteriorly and posteriorly. I don't appreciate any shoulder asymmetry or hips asymmetry. And then I'm gonna palpate for the spine for tenderness or pain. You have any pain?
No.
Any pain?
No.
Upon palpation, I don't appreciate any swelling, tenderness, or nodule along the spine. And I'm gonna use the ball of my hand to percourse along the spine. You have any pain?
No.
Any pain?
No.
Okay, now I'm gonna have Bella to bend down to try to reach your toe. And I'm gonna palpate or note for the spine. I don't appreciate any sign of scoliosis and no ribs hump or no shoulder asymmetry. Thank you, Bella. Next, I'm gonna do the test. Can you bend? Can you reach your toe for me? Flexion, and then can you stand up, and then bend down as far as possible. Flexion, and then can you turn to your left? With your hip, turn to your left. Now turn to your right, and then try to bend. Yeah. So I appreciate full range of motion of the hip for flexion, extension, lateral rotation bilaterally, and lateral flexion bilaterally. Now I'm gonna have Bella lay on the exam table. I'm gonna check the straight leg test. Okay, Bella. Now you're gonna flex your feet, and try to bring your right leg up with the feet flex. Try to bring it up. Any pain?
No.
Okay, good. Now you're gonna do the same for your left leg. Any pain?
No.
Thank you. And then, can you please sit up? So I didn't do the empty trash can, so I'm gonna have Bella to do the empty trash can to check for the supraspinatus muscle. So imagine you're holding a can, and then you're gonna empty it. You have any pain?
No.
Do it again. Yeah, I appreciate the smooth movement of the shoulder bilaterally, and Bella has no pain, so negative empty trash can. Okay, do you have any question for me?
No.
Okay, thank you. So I'm gonna put my finding on your chart. If you have any questions, just let me know, okay? Thank you.